Finance Administration Committee meeting to order. At this time, we'll accept public comment. If there is any public comment. Seeing none, we'll move on. Entertain a motion for the consent items, the approval of the agenda and the approval of the minutes.
So moved.
Support. Any changes, corrections? All in favor, say aye. Aye. All opposed, same sign. Motion passes. Action items. Need a motion for the 2022 budget adjustments.
So moved. Second, sorry. Gotta get this down, just the two of us.
We'll get there. Come on, Doug. Karen, anything special?
I know there's a long list there, but it's really just all the normal kind of
Just
adjustments we're
housekeeping
making, housekeeping grants and funding of some projects that are underway.
Okay.
Yeah, Karen,
Questions of Karen?
sorry.
Yeah, go ahead.
Can you just talk about the appropriation of funds to cover the cost of expert witnesses for 30,000? Is that kind of out of budget cycle? That's kind of a big amount or not really?
Well, we don't always have those kind of jury trials or those kind of trials, so
Sure.
we don't put it in their operating budget, and then if they need it, we do an appropriation like this.
So is-
Otherwise, we have some years we would have it just sitting there.
Okay, so is this being driven by a specific case or a
Yes.
specific case is?
It's I think it might be 2 cases,
Okay,
but I'm not 100%.
okay, so that's
sure of that.
basically how we do is wait until we actually need them and then make intercycle appropriations.
It's from contingency.
Okay.
right?
All right, cool. Thank you.
Any other questions? All in favor, say aye.
Aye.
Aye. All opposed, same sign. Motion passes. Need a motion for the statement of review. So moved.
Second,
Any questions, comments? All in favor, say aye.
aye.
Aye. All opposed, same sign. Motion passes. Need a motion for the 2023 budget calendar.
So moved. Second,
Pretty much,
It's very similar to prior years. This is considered best practice that there's a calendar established, and then communications will go out to the department and agencies with a lot more detail.
okay.
Chair, do we have a date yet set for the board planning session? That,
I think Regina's working on that right now in
Okay.
terms of,
She was getting really
That's-
close.
that's gonna
to
come
us.
after the May 6th, like most likely, right?
I honestly, I don't know what date she had. I thought she was looking at some in April, but I don't know.
Okay.
It was really depending on a lot of your guys' schedules.
Right,
For that.
yeah, I saw there was a May and then there was a June. Right now, we got it sandwiched between April 11 and May 6th, but it's probably not gonna happen then.
I don't know when the time frame when I put that to be determined. I
Right,
just-
no, of course not, no, I'm not, I'm just wondering when that's gonna happen, if that's gonna happen after that May 6th, which is likely, right?
Anything else? All in favor, say aye.
Aye,
Aye. All opposed, same sign. Motion passes. Need a motion for the resolution to appoint a new equalization director.
so moved.
Or.
Yeah, we're pretty fed up with Mike, and so. No, Mike has announced his retirement effective June 30th, and I'm sorry to see him go because he's been great to work with. The department runs without a hitch, never have to worry about anything in equalization. And fortunately, with Brian Busker, we've got someone that'll just fill in those shoes and not miss a beat at all. So we've got really good people at equalization and a really good succession plan here. So our recommendation is to accept Mike's retirement effective June 30th, and then to appoint Brian as the equalization director effective July 1st. It's one of those officer positions under state law that the board actually has to appoint. So that's why it's before the committee and then to the board next week.
Okay, thank you. Michael, thank you for, I know it's early yet. You've got a few months left to go yet, but we really appreciate everything you've done. How many years have you had with the county?
Probably hear me better if I come up here. I started with the county in 2000.
Okay.
I was working for Spring Lake. I got my level 4 there. And the deputy who there at the time decided he liked being retired better than there. So John brought me in as for 4 years until he retired. And when he retired in 2000, I was appointed director.
Okay.
And John, funny, when he retired at 55 on the day, he had his trunk packed and he was headed for Florida. He'd been here since, he'd been working for the county since he was like 17, I believe. And just interesting.
And are you moving to Vegas is what I heard?
Now, sometime warmer would be nice, but all my kids are here luckily, so the grandkids are important.
Well, you can always find a warm place when it's cold here. So,
Yeah. Yeah, but we've done something similar here. You guys have been very supportive of the department. And there was a time when we had 3 level 4s in the department at the same time. And Holland City was recruiting Jim Bush and Holland Township was recruiting Brian. And it was good of you guys to help us do something to keep Brian here in the interim until I retired. And that's gone well, very well. He's ready and up to speed. And I don't think they need me at all anymore. I can retire and won't notice any different, which is the way it's supposed to be.
well, and it's nice to be able to retire and know that what you've done for the last 21 years, 22 years is in good hands and you don't have to worry about the department going.
Yes, it is.
downhill. So Brian will do a good job.
Yep.
So, good, thank you very much. Anything else? All in favor, say aye.
Aye.
Aye. All opposed, same sign, motion passes. Need a motion for the Parks Department personnel request.
So moved.
Or questions, comments, Jason, or?
Jason, yes, but probably not the one you were looking at. I'm Jason Berger with the Parks Department. We've had some trouble the past couple of years filling all our seasonal positions, as you know, all employers of part-time workers have. And so this year our staff met and brainstormed and came up with a whole bunch of ideas, just one of which was increasing wages. And then we met with HR and did some salary surveys with local employers and parks throughout Michigan, and came up with what we thought was a fair and hopefully a wage that would help us attract a full staff this year. And then put that into our budget, came up with a cost, and then came up with a process of covering that cost since we're mid-budget year. We have, we're implementing fee machines at our parks, and we hope that that will eliminate some staff time. It will increase revenue. And then we also had some projects that were budgeted for capital that are now covered by grants. So we got all that covered in our budget and all that worked out. So we're looking for approval to increase those wages mid-budget year so that we can fill our seasonal positions this year.
Okay.
Questions?
Just a quick question. You mentioned fee machines. Are you still offering the annual pass?
Yeah, the parks that have the fee machines will have annual passes. It will be at a non-discounted rate, so it would still be beneficial for residents to purchase them in person from the park office, the nature center, treasurers, other places like that. So they will be at the higher $25 rate. It'll be a printed pass, and then that can be exchanged somewhere else for your hang tag or your sticker. But if you're just there in a pinch and you want to get it that day, you will be able to. But we're definitely encouraging planning ahead or buying them online or at one of those other places and getting them that way.
Any questions?
Yeah.
Go ahead.
Hey, Jason, how is this going to interact with agenda item 12? No interaction whatsoever?
I don't believe so.
Okay. So
Because
when we
that's
looking at 12, we're
12
not
is,
look-
I don't have it in front of me, but 12 is about benefited employees. Am I
right,
correct?
exactly.
Yeah,
So
okay.
there's no relationship with what we're
No.
doing there on the parks. Okay, thank you.
Any other questions? All in favor, say aye.
Aye.
Thank you, Jason.
Thank you.
Aye. Motion passes. Need a motion for the public health personnel request. So moved.
Second.
Good morning. My name is Sandra Lake. I am the Community Health Manager at the Health Department. And I'm requesting this morning that we split a current 1.0 FTE into 2 part-time positions for a couple of reasons. First, in the last 4 years, we've seen about a 65% increase in our referrals to our program, and our team simply can't keep up. And so an additional body will help us see more families and enroll more clients. And then second, we've had a vacant position since early November when a nurse retired. And we've had extreme difficulty filling that position. We've only had 2 applicants in the past 3 months, one of which is only interested in part-time work. We've also reached out to a few people who we feel like would be good for the position, either because they have previous experience or expressed interest, and they too are only interested in part-time. So we feel like this change will help us recruit and retain staff. The cost will be covered by the public health fund balance in this year and then part of next year. However, we feel like moving forward, once we get to fiscal year 2024, the position will pay for itself through program revenue, cost-based reimbursement, and other state and regional grants. So, other questions?
Yeah, real quick, Sandra, is this kind of a model that we could look at going forward, kind of splitting up the FTEs into, part-times? Is that something that Marcia's looking at as well?
Potentially, I think it depends on the position. I think nurses kind of enter the workforce for part-time positions, but it kind of depends on the role and the program itself.
Okay.
Unless you want to add
I
anything?
was just gonna add, you're probably all aware because you've seen it all over the news that we're experiencing a really significant healthcare worker shortage, specifically in the registered nurse space. And this is an attempt on our part to try to get creative to recruit nurses into this position. We used to have lots of pieces and parts, little part-time positions here and there, and it in some programs can create some difficulty, especially in more of a clinical space, because we need to have a body there every day, all day long. In this program, because they're field workers, we can offer a little bit more flexibility and feel that a part-time position could work really well. So
okay.
We're always looking at how to be creative to get and keep staff.
Right, thank you.
Other questions? Thank you, ladies.
Thank you.
All in favor, say aye.
Aye.
Aye. All opposed, same sign, motion passes. Need a motion for the human resources personnel request.
So moved.
Support.
I feel like you guys might see a lot of me today on some of these. So what I'm requesting is to move forward to put the assistant HR director position back into the HR department. In 2017, we eliminated that position because we were taking a stronger focus on we needed additional payroll support. And so we eliminated that spot. At this point, obviously, with all the position requests you see coming forward, the current labor market, the COVID tracking, even for employees, the HR department is in need of some extra support. One of the positions that we had open was a recruiter position, employment analyst position. We've been unable to fill that. Recruiters are in high demand right now in the labor market. We can't find anyone that has experience where we're at right now. And implementing this position for the time being instead of that position, probably will be back next year on that one. But looking at providing full support for the HR department. It looks like right now we're on track. Just in the first month and a half, that we're about 10% higher on hiring than we have been in the past. So we have a lot of retirements coming in, processing all these changes. When we look at making changes to departments, changes to structures of positions, that affects every piece of HR. So that's why I'm requesting this assistant position, so we can jump in and have a little bit more support as we're processing these things.
Marcy, are you taking the wages or from that recruiter and using them for this and then adding another 35?
Yes.
Yep.
Yep.
Yes.
So that hopefully lighten the load momentarily on the budget, but just with the full understanding that we're really struggling right now in HR to process through employees as they're retiring, as new ones are coming on. And even looking at a lot of the changes with COVID, as soon as some of the new COVID rules came out, we had bargaining groups wanting to bargain contracts, open those up. And obviously there's some new agenda items after this that we're just continuously putting out fires at this point to try and stay afloat. So that's why I'm requesting this position back that was eliminated in 2017.
Are you optimistic you'll be able to find somebody?
I sure hope so. It better be better than trying to find an employment analyst, that's for sure.
Any other questions? Thanks, Marcy.
Thank you.
All in favor, say aye.
Aye.
Aye. All opposed, same sign. Motion passes. Need a motion for the Economic Development Corporation proposed bond project. So moved.
Support.
John?
So
Oh, go ahead.
Becky's here, but
Becky.
Becky's gonna bring up there's a independent and assisted living housing project in Holland that's looking for financing and under our EDC. So Becky, you can provide more details, but they're looking for us to issue some bonds that we would not be required to repay or count against our debt limitations.
Correct. Yeah. Good morning.
morning.
Yeah, so we were approached to do our third Economic Development Corporation bond project. The requester is Rest Haven. They do living facilities for seniors on a variety of different types of care levels in the community. You guys might be familiar with some of those. The project is proposed for the City of Holland, and they are in agreement. The site plan has been approved. We've talked to Keith, and they approved the plan and support the use of the bonds for this purpose. Just a little bit of background. Like I said, this is our third bond project. We're authorized under Act 338 to issue tax exempt bonds for eligible entities such as Rest Haven, which is a nonprofit. We've used the bonds for Hope College in the past. In 2011, we bonded a $6 million project for Hope College. And then in 2015, we did a $5.4 million project for North Ottawa Community Hospital to expand their ER. And so this is our next request. We do have Seth here from Rest Haven, who is on hand to answer any specific questions I may not be able to answer for you. But in a nutshell, the Board of Commissioners is going to go through 3 different steps here. Today, we're going to appoint some additional directors that we need to the Economic Development Corporation to make sure the community is properly represented as we do this project. That will happen today, among a couple of other things on this resolution. Then you're going to hold a public hearing so the public has an opportunity to come before you and make comments. And then you will lastly approve the project plan and allow us to authorize issuance of the bonds as an EDC. And that bond amount is $75 million as a not to exceed. We may come in underneath that. It does not require the full faith and credit of the county. The county is not responsible in the event of default. The borrower is entirely responsible in the event of default. We will have bond counsel. You know, I always joke about this book. It literally is several inches thick from the Hope College project, bound documents from the closing process. So bond counsel is required to help slog through all of the things that are necessary to make these projects happen. And bond counsel is paid by Rest Haven, by the borrower. The county will incur no fees to go through this process. And then quite the opposite, we do assess a 1/4% of the face value of the bonds is what the county will be paid. So if the full $75 million amount of the bonds is borrowed, that would be roughly $187,000 in a fee that the county would then receive for going through the project. And that would sit, I would assume, with the EDC or the county to decide how to utilize that for the good of the county. So in a nutshell, that's the project. We can give you some more details as to, you know, number of units, location, or if you'd just like to ask me some questions or Seth questions, fire away.
Are these taxpayers?
I'm sorry, the borrower?
Yeah, do they pay property taxes?
That's funny. Seth sat down and I confirmed with him, they are a nonprofit, so they do not pay property taxes. They pay some special assessments in a few limited situations. They pay property taxes in the event that they lease out portions of their property, but they do not pay property taxes. They do employ some 400 and some odd folks. I think, in the community right now, and they're building, I don't know how many units they have in their total agency, but this will provide 128 living units for varying levels of care that are much needed in the community, which hopefully will then free up some starter homes for some other folks in the area too, as these seniors who, they've got bookings for this facility already. They've got quite a few reservations for this facility. So that will have some positive impacts. While they're not paying property taxes, there are some really good community and economic benefits to the project.
Is it typical, and I'm very supportive of this, but is it typical for senior housing programs not to pay property taxes?
If they're, well, not necessarily, it's a nonprofit. Now, we did, if you remember, Quincy Place project that we did for that PACE loan back in June, they are for profit. Rest Haven is a faith-based, not-for-profit. Well, I guess I let Seth expand, but they're faith-based, so they're nonprofit versus Quincy Place, who is a for-profit. So that would be the difference there. That's why they're not paying property taxes and why they're eligible.
Yeah, real quick on the bookings, do we have an idea, or Seth, do you have an idea where those are coming from? Are those coming from nearby, or are we pulling in folks from wider areas? I mean, are we gonna free up houses in the city of Holland, or we don't know yet?
Yeah, so far there's 104 independent living units that are part of the master site plan, along with 24 assisted living units. Of those 104 units, we have 74 pre-reservations, so a little over 70% thus far. The vast majority of those are from the Holland area. We are drawing a little beyond that, whether it be California or Kalamazoo or Traverse City area, but the vast majority are within the Holland.
So we can be expecting to have some tip over
Definitely
from the immediate area.
Yep.
Okay.
We actually already have some residents who are moving into our other facilities, selling their houses now so that they can leverage a strong housing market.
Okay. No, there's the Rest Haven on 9th in River. That's not part of this project, right?
That is separate from this project, but it is a part of our organization.
Okay, and that is the nonprofit arm as well, right? So
Correct.
that's not paying property taxes added to the city.
That's a slightly different model. So we're actually leasing that building from GDK. GDK pays property taxes. We pay GDK through the lease. So on that building, that's structured a little bit differently because of who maintains ownership of the building.
And who is coming into that building? Is that also City of Holland area residents? Or are you
Yes.
seeing wider?
Yeah, primarily still City of Holland. We do have for that one, there's 21 units, so it's much smaller.
Right.
We have 4 or 5 pre-reservations currently. I know one individual who's coming beyond Holland. The rest are from Holland. Yeah.
Okay. Good.
Yep.
All right. Thank you.
Seth, this new project, that's 24th Street,
Yes.
Waverly.
Yep.
That's what I thought. but-
Correct. Yeah, on 24th between Waverly and Country Club.
Any other questions? Thank you very much.
All right. Thank you.
All in favor, say aye.
Aye.
Aye. All opposed, same sign. Motion passes. Need a motion for the courtroom presentation solutions.
So moved.
Second.
Susan Franklin's here, our circuit court administrator, to explain this issue.
Good morning. This is for the purchase of and installation of 10 Wolf Vision sign-apps. These are units that go in the closet behind our courtrooms and allow people to plug in and present their evidence so that we're not just passing papers around. It goes through our electronic system and is able to be recorded into our court recording system for future use as well. We had a equipment called a point maker that was doing somewhat of the same job. However, those have been failing at a rapid rate, and our recording system contractor BIS recommends that we replace those with these Wolf Vision sign-apps, which have been working much better. We've done a trial of a Wolf Vision sign-app for free for the last 6 months, and it's been working well for us, which is why we're pursuing the purchase of these units for the courtrooms.
Questions? Susan, with the new Family Justice Center, we would just add these there.
We would move those.
Part of that construction cost or build out cost.
Yes.
All right, thank you.
Thank you.
Any other questions? All in favor, say aye.
Aye.
Aye. All opposed, same sign. Motion passes. Need a motion for the contract for financial advisor for the issuance of bonds.
So moved.
Second.
In 2019, we did an RFP to select a financial advisor. At that time, we had 4 responses and we selected Baird to be our financial advisor. We have worked with Warren Creamer for the last 2 years. It came to our attention last month that Warren has left Baird and has gone to a new firm, MFCI LLC, which is doing the same work in the same capacity. For all practical purposes, our relationship with Baird was our relationship with Warren. So we would like to enter into this contract with MFCI to continue services and for continuity of effort, working on all of our bond deals.
Pricing the same?
Pricing is the same.
Okay. And just if you get, I just got to note it, you guys can just keep the microphones a little closer to you, just so it's easier for people on Zoom to hear you.
Any other questions? All in favor, say aye.
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 All opposed, same sign, motion passes. Need a motion for the temporary non-benefit wages.
So moved.
Support.
Marcy?
So this request is currently, we went through the entire wage study and put most of our groups on the universal pay scale besides our 312 groups from the sheriff's department. With moving people to that universal pay scale, we do have some temporary positions that have a full-time equivalent. A good example is a clerk typist matron in the sheriff's department. The temporary non-benefited position works less than 20 hours, has no benefits. In the past, those temporary positions, we would look at them every year, decide whether or not they get a COLA. Some positions did, some positions didn't. What we want to do with this section is if we have a full-time equivalent, we want to make sure that temporary rate carries with that full-time wage at the A step. So that every year we're not coming back saying, should we do a 2%? Have we gotten out of line with what the market is? Now that we've done the wage study, we know where we need to be in line with those benefited positions, excuse me, and then add these so they carry along at that A step.
Marcy, where is this coming from? It's 15,250. Where are we funding that from?
So there will be a budget adjustment that is processed next month, but the general fund will be funded with contingency. Some of the other funds may be funded with a grant but we've looked at all the funding related to this.
Okay. Okay, thank you.
And some of those temporary positions are open too, so
Won't hit right
just
away.
trying to get them filled.
Right,
So, thank you.
Any other questions? All in favor, say aye.
Aye.
Aye. All opposed, same sign, motion passes. Need a motion for adjustments to compensation for benefited employees.
So moved.
Support.
Marcy, you're getting your steps in today.
Yeah, well, I'll let her rest for a second
Oh,
here.
okay.
So, well, you've seen it even at today's meeting in terms of the difficulty of filling positions. And, there's been quite a bit of turnover. So we're really in kind of an unprecedented job market, at least that I've never experienced. And so we're trying to look at a way where a number of different methods to retain employees, because it's very disruptive to lose employees. It's expensive to replace them, and it causes a lot of disruption in our operations as well. So we looked at a couple different things here, and a lot of this job market, perhaps the catalyst was the pandemic. So the pandemic's been going on for about 2 years now. And so one of the steps we're looking at doing is for any benefited employee, excluding elected officials, but for any benefited employee that has worked throughout the 2-year duration of this pandemic would receive a one-time payment of $2,000. And we would prorate that so that if they had worked 20 months, we'd pay them, I think it's $83 times 20 months, whatever that works out to be. If someone's been here for 1 year of the 2-year pandemic, they would be paid $1,000, and again, prorated for those that work 10 months versus those that work 19 months. And so that would be a one-time payment. And then the other thing, as you know, we just implemented a new wage scale, and we contacted the consultant that did the wage scale and said, look, the fact that you guys gave 2% is already almost putting your wage scale out of date almost from the very beginning, and recommended an additional 2%. And so our recommendation there is to increase the existing wage scale again for benefited employees, excluding elected officials, an additional 2%. These payments would most likely, if approved, go into effect in April. So that wouldn't be retroactive or anything like that. And, we can fund this cost from vacancy savings in our current budget from a lot of positions. I mean, Marcy just mentioned one position that we had trouble filling, but we have other empty positions as well. To the extent that that won't cover it all, we've got ARPA lost revenue savings that we can use. And then there'd be some other dedicated funding sources like Medicaid grants and millage funds. So that's our recommendation. And I do know, and I think there's some information in there, that some other counties and even some of the other local units of government within Ottawa County are all looking at wage adjustments in line with what we're proposing.
Questions for Ben? Go ahead, Greg.
John, is there any legal way that we could do this $2,000, that it's a non-taxable event? Could this be put into someone's retirement account so that they don't have to pay? They had a choice, take the money now or put it to the retirement account and not pay taxes on it at this time?
I'm definitely not a tax expert, but I know if it is given as a one-time payment, I've got to believe it would be subject to income taxes, and that's something that they.
And again, I don't want any gray area. I'm not saying that. I'm just saying if there's a way, we just saved $75 million in property taxes from Rest Haven. I was hoping we could save some money for our employees somehow.
Yeah, I don't know the extent if we did it as part of a retirement payment, what the tax implication would be for that.
One thing we are going to do with this, when we pay this out in April, that 2,000, we'll do it as a separate payment, which will influence an employee's taxes if it was added onto their regular pay for the week. Obviously, it's still going to hit their taxes the same overall. The other option that our employees do have, which we would leave that up to the option of the employee, because some people would probably like the cash in pocket right now. But with our 457s and our HSA accounts, employees can put the money in. For example, if their HSA account wasn't already at the maximum, they could put that money in there and save in that respect, or the 457 plan that we currently have in effect. So we do have a mechanism to give some freedoms around that, but we're still following the federal IRS guidelines and making sure it's taxed properly.
Exactly. Save some taxes at this time for the employee. Nice to give them that option.
Yep. So those options will be available to employees.
Marcy, would that hit in time that you could fund an IRA before tax time, or when in April exactly is that arriving? I mean, you could theoretically put it into an IRA real quick if it gets before tax day, right?
So we're looking at making this payment before the end of April. Some of
Okay.
it's just the setup of, now we have to go ahead and change all the pay scales and such. So that's why we were looking at April for this. So I'm not sure exactly what tax consequences are and when IRAs. I just don't know that information.
I think most people who are in a plan can also do a private IRA up to $3,000 or something like that.
Right.
So I think that's what you're referring.
But you'd have to have the money in hand in order to do that before.
Well, it would count your 2022 tax year.
Correct.
It's not going to affect 2021.
Mhm.
That's closed.
Any other questions?
Yeah, real quick. How many folks in the seasonal non-benefited are we leaving out? I mean, considering what Parks has done and what you did in the previous item and then this, are there still a fair number of non-benefited seasonal folks who are not going to see something?
I'm trying to think exactly where our seasonal, our non-benefited employees are at. I think that's We probably have, do you know how many seasonals you guys have off the top of your head? About 100 that we will be putting on. And then we have a lot less over in the sheriff's department now with the reserves because of the combination. But possibly about 150 employees
Okay.
that would not see this. In some respects, we're changing the scale for the seasonal, knowing what the rates were
Sure.
before we head into the seasonal time for the parks. And some of those other ones that I brought through that have a benefited equivalent are getting,
Right.
we'll see some of that and just the rate is increased, but we're not adding this to non-benefited employees.
Okay. All right. So there's not going to be a ton of folks who are not going to see anything at all.
Correct.
Okay.
Any other questions?
Thanks, Marcy.
Thank you.
All in favor, say aye.
Aye.
All opposed, same sign. Motion passes. Need a motion for the quarterly financial status report.
So moved.
A second.
Karen?
So our financial report for December 31st is submitted here, and I would say that we are seeing a slight slowdown, and I don't know if it's a timing issue, but like in the recording fees. So our first quarter, that is not the big season for recording in the Register of Deeds office. We are also seeing a number of vacancy savings, as we discussed earlier. So departments, their underspending may be a little bit more significant if you compare it year over year. When you get to CMH and the mental health fund, you'll see the Medicaid. So they have been discussing rates, and there is an agreed upon rate, but it has not actually officially been processed yet. So you will see a Medicaid that is slightly less than what we had planned, because is that they're just slow this year in getting that to start paying those funds. But all in all, everything looks it looks good.
Okay. Questions for Karen? All in favor, say aye.
Aye.
Aye. All opposed, same sign. Motion passes. Thank you, Karen. Treasurer's report, Amanda.
Just want to mention, I think the big news right now is just inflation. The producer price index came out this morning, so it's a 9.7% increase over the last 12 months. So that reflects the supplier conditions that we're experiencing in the market. Last month, I think I shared that the Fed was considering raising interest rates about 3 to 4 times this year. Now I saw a report this morning, it might be 6 times as a way to moderate the inflation. Inflation seems to be what I'm dealing with right now, but it is helping bond rates. So it's a great mark for me as we go out and invest. One thing I wanted to share, as we get closer and closer to foreclosure deadlines right now, we start tracking year after year how many folks are in that position of being foreclosed on March 1. And last year, on March 1, we had 91 possible foreclosures. Today, we have 77 possible foreclosures. So I think I'm not sure what that's about. It could be the federal stimulus that's been trickling down to homeowners, but it's a good sign that we are not facing as many possible foreclosures come the end of March. So other than that, are there any questions for me?
I would think, Amanda, that the foreclosure rate being down so low is because of housing prices in Ottawa County. Last month, they said it was the average price in Ottawa County home, $359,000. So if somebody's in trouble, they could probably put their house on the market way quicker than have it foreclosed on by the county.
Yeah, and I think that's very similar to the national average for home prices. I think I did mention last month the My Half program, Michigan Housing Assistance Fund, and I think Doug might have asked how far back are they allowing taxes to be part of that grant that goes out, and they are only allowing us to go back to 2019. So, and what I'm seeing as people come into our office asking for possible exemptions is nearly everybody has somehow been affected by COVID, so could apply to this program. We do have a few people that are outside that 2019 delinquent tax window. So we're still working with them, but that's good news for those folks, especially I think it's going to affect Wayne County, Genesee County more so than us. But again, the 200, that program went live yesterday. And there are a few places in Ottawa County Community Action Agency and a facility or assistance agency in Grand Haven that if you need assistance, contact our office for help, but also those two agencies can help taxpayers with taxes and apply to that program. So it's getting the word out that you can access that money.
Questions for Amanda? Thank you, Amanda.
Thanks.
Second opportunity for public comment. Any public comment? Seeing none, entertain a motion to adjourn.
So moved.
We are adjourned.